Bismillahirrahmanirrahim. Madam Minister, Dr. Azra Fazal Pechuho, Minister for Health and Population for the Government of Sindh, President, Population Association of Pakistan, Dr. Nizamuddin, Dr. Tabinder Sarosh, Country Director for Pathfinder International, Secretary from the Federal Ministry of Health and Population, Secretaries from the Provinces for Health and Population Welfare, representatives of the civil society organizations of UNFPA, Ms. Yasmin Kazi, representing the Bill and Melinda Gates Foundation, Dr. Talib Lashari, who is the architect of the Costed Implementation Plan, Government of Sindh, many colleagues and friends, and the strong advocates for family planning and reproductive health. I'm very pleased to be here with you virtually for this seminar, which is focusing on the right to family planning and reproductive health. It promises to be a very exciting webinar, which will look at the developments that have taken place in family planning and reproductive health across Pakistan, and linking them, of course, with international thinking and international support, partnerships, and development. The chief guest of the webinar, which is Dr. Azra Fazal Pechuho, who is an absolutely remarkable leader, combining in herself the deep knowledge of the health sector along with the population welfare program, and who has led from the front in Sindh. Many of her achievements are noteworthy and they are well known. And certainly she is the most appropriate person here to be the chief guest here. In herself, she is a powerful catalyst in the government of Sindh, and she is certainly listened to by the Chief Minister and the Cabinet. Sindh has, of course, a number of things to its credit over the last 2.5 years, and I will come to that in a few minutes. But the partnerships between the professionals, the experts, the policy analysts, the researchers, academicians, those who implement the programs, and those who can step back and take a look at what is taking place and what else we need to do. All of these people who have been brought together here through the powerful invitation, I would say, and the powerful presence and the very, very long history behind him of Dr. Nizamuddin, who is the president of the Population Association of Pakistan. It is incredible, Dr. Nizam, how you're able to combine a number of different representatives across the landscape of Pakistan who have committed themselves to working in family planning and population welfare. Your symposiums, your annual events, the research papers give a lot of credit, certainly to you and your team, and for you having taken the Population Association of Pakistan to a level which is really a significant contributor. Dr. Tabinder Sarosh, Pathfinder's international support to Pakistan in its efforts to provide services, family planning, commodities, services, and to assist the government in its particular plans for reducing fertility and increasing CPR. A number of friends and colleagues are there, so my regret is that I'm not there with you personally in Islamabad, but I think this virtual world allows us instant communication and instant connectivity. I've always thought about rights because I think the rights agenda is a very powerful agenda. Decades and decades ago, there was the Universal Declaration of Fundamental Rights, of Human Rights. And modern day civilization, both in the latter part of the 20th century and into the 21st century, has molded itself in many, many countries in the world around this agenda of basic human rights. fundamental rights, this powerful agency that defines the rights of people everywhere. So whenever we talk about a rights agenda, it really is a very powerful signal that we are sending to everyone, to the economic planners of a country, to those who are interested in further progress and development, in fact, to all shades of political and economic opinion. The rights agenda has talked for years and decades about the right to education, the right to livelihoods, to security, to housing, to employment, to clean water, to a safe environment, to justice, to social equity. All of these rights we've been hearing about. Many of them have transferred into laws, legislations, into programs and interventions. And yet, really, there is a very, very large and unfinished agenda around rights. And this lobby of people, this constellation of everyone who is working in Pakistan, who I've always considered a very, very powerful lobby. In fact, this is like an assembly. It's an assembly of those who represent the right to family planning, the right to reproductive health. And in the last several years, though we have done it rather late in Pakistan, but Pakistan certainly has arrived on the scene with legislation, with laws, and certainly with renewed and refreshed vigor, relooking and revisiting the major interventions of our programs in family planning and reproductive health. So clearly, if you don't focus on this right, all other rights are impacted negatively and adversely. We have very strong economic arguments. That goes without saying. And of course, what can a 5-year plan for Pakistan do if it's not looking at its population, its demographics? Which way is the needle going? Presently, we have something like 65% of our population under the age of 30. And we have at least 3% of our population entering the workforce every year. Can we provide these jobs, these livelihoods, the housing, the transport, the water, and many, many other needs of people and societies and families and communities if our population growth rate is still going to hover over 2%, close to 2.2%? So the question, I think, is now very starkly staring Pakistan in the face, that are we going to pursue just an isolated, fragmented approach towards health and family planning and reproductive health, because all three are very, very closely intertwined. And I would definitely add education, because unless you provide education at a mass and universal level to everyone, to every child, and ensure that it is not only secondary, but post-secondary at a minimum, this agenda that is calling out to us, this is what we must recommit ourselves to. Now, what are the different aspects that I think we need to look at? When we mobilized ourselves in response to the Supreme Court order, and I would say a level of interest taken by the then Chief Justice and the justices who were sitting on the bench on this burning issue of population, we had several meetings, and we clearly said that we need to place the rights argument squarely in the center. And what should support it? I think the argument for economic justice. This is vital. If the population grows at a rate at which the country cannot support its people, cannot provide for the welfare of its people, clearly the economic pressures on the government, provincial, federal, all institutions, all aspects of our life in Pakistan are immense. And unless we look at the strong and powerful economic argument of having planned families, of allowing the choices to the couples to adopt family planning methods, the long-term modern method of contraception, other methods of their choice, to be fully educated and be made aware of these choices, and to know that there should be no hesitation, no embarrassment. There should be no questions asked. why are family planning services being provided? So the government needs to pitch its resources. If it pitches its resources into family planning and reproductive health, services, accessibility, affordability, availability, and quality at every single health outlet, not only in the public sector, but in the private sector as well. And we know that there has been some legislation in this regard. Sindh has legislated, other provinces have legislated. This is the powerful argument that we must present before the economic planners of our country. And when the Supreme Court took up this issue, I think it gave it a tremendous amount of steam. And it stoked the effort further. And people began to listen after it became public, through media, talk shows, discussions. And then there were 22 points that were presented to the Supreme Court, that these were the critical element points in moving forward. Subsequently, they were taken to the National Council, and the National Council also supported them. And there was a fund that was dedicated to it and delegated to it. However, it's unfortunate that that commitment has yet to be fulfilled by the federal government. And we hope that this is the year that that commitment will be fulfilled, of dedicating at least 2 billion out of the recommended 6 billion, particularly and specifically to a fund that will promote demonstrated effective interventions to reduce the fertility rate and increase the CPR, and to provide all these services that I have just mentioned. So there is now a recognition, I think, at a level, and now it's recorded. This is part of our history. It is documented. Decisions have been made. And these decisions certainly reflect the fact that the influence of the advocates, the practitioners, the experts, the researchers, the analysts, the development specialists, all of whom are contributing in this webinar, that they have been heard. We certainly need to take it to the next step. The next step is beyond the economic argument. It's the human rights argument. And a violation of human rights then needs to be highlighted. The same way as we highlight the violation of the right to education. When we say if all children are not in school, who should be held responsible? If people do not have security, who should be held responsible? If there's no clean drinking water and sanitation, who is held responsible? I think in the same manner, there should be the question that people should pose to the government and to their representatives in the national, provincial assemblies, that who's responsible for a woman who dies at a young age, who gives birth to 6 and 7 and 8 and 10 children? Who's responsible for the stunting? Who's responsible for the malnutrition? Who's responsible for too many children in a family? And in the poorest quintile, most of these children are out of school. Who's responsible? Unless we take the right decisions, unless we take urgent action, and unless we provide for the welfare of the family. And at the heart of the family is the mother. At the heart of the family is the couple. At the heart of the family is the child. And it is about the mother, father, the couple, their child, or their 2 or 3 children, whose welfare is critical and should be ensured. And this is their right. So this seminar today and tomorrow will focus on different dimensions of what has been done so far. How effective has that been? How successful has that been? How long-lasting can that be? And what are the resources needed to multiply that effort, to accelerate all the efforts across the country wherever success has been demonstrated. I'm a very strong believer in evidence. If you have evidence of success and you can share what it takes in terms of human resources and financial resources, system strengthening, technical resources, and in this day and age, to be able to gather data, you have all the electronic systems available in our country. Data can be gathered, it can be analyzed, it can be collated. And I'm not just talking about government efforts, because the civil society, the non-governmental organizations, the international NGOs, these are very, very important partners. The services provided by them are as critical in many places, if not more so than government, because many of the civil society organizations are reaching out to those populations that are often left unreached by government. So the partnerships, the collaborative efforts, the international support, it's not just funding support that we look for internationally. It's knowledge, it's best practice, it's learning, it's better ways of structuring systems, it's better ways of looking at indicators, it's better ways of looking at our human resource and to see how can we retask it, reskill it. How can we make that particular human resource, let us say the lady health workers, or the family worker, the population welfare worker, the community midwife, the private sector doctor, the practitioner, how can we make each one of these who's contributing into multiplying their efforts and achieving better results and longer and more self-sustaining results? Clearly, we are at the beginning of our efforts of this new decade, which will start in less than a month, 2021. It can be a decisively different year. It can be a decisively different paradigm, buttressed by evidence, by the strong belief that we can provide that framework of laws, support, resources, and the services. And there can be no better group of people than this group that is participating in this seminar that can take this agenda forward. We all have very high hopes, of course, of our political leaders. And we have, of course, Dr. Azra Fazal Pechuho here today, jointly with the professionals and the experts, all those that Dr. Nizamuddin has worked with and many other people who have built teams and who've contributed. I think we have the knowledge base. I think we have the expertise, we have the skill levels, we have the commitment. We now need to activate the commitments that have been made via the Supreme Court judgment through the government. And that's the partnership that's very, very vital. And that has to become much more active than in the past. I'm connected with academia. So at the end of my thoughts that I've shared with you, I definitely do want to leave this thought that the academia also needs to be brought into this discourse, this dialogue. It's the academia that also needs to look at the new narrative. They need to assist us in further defining that narrative. And that narrative is not just out in the field, left as a collation of numbers and data sets, but that narrative has to be translated into intellectual discourse, into academic discourse. Look at the millions of young students, men and women, who are studying in our universities. They are your future fathers and mothers. They are the future of Pakistan. And they need to know how important this right is. The right to family planning, reproductive health, the right to health, and the right to education. So I leave you with that one thought, that we do need to reach out to academia, perhaps more than we have done in the past, in the same way as we've reached out to policymakers, to professional development experts, and to other partnerships. I'm very hopeful. In fact, I'm very optimistic, more optimistic than I have been in the past, because I think we have that combination of political commitment and expertise and leadership. So I wish each and everyone who's participating in this seminar a very, very enriching experience with the sharing of thoughts and knowledge. And thank you once again, Dr. Nizamuddin, for this opportunity for me to share my thoughts with you.